Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, thanks for joining me on another episode of the Egg Whisperer Show, and tonight's episode is how to survive your Hsg. You're probably asking, what is that? Well, let's break it down. Hysterosalpingogram. Hystero, uterus, salpingo, tube, gram, picture of. It's basically a picture of your fallopian tubes. So you've seen me do this before on the show. For those of you who are in my inner circle, you know what an amazing dancer I am. But basically, the fallopian tube is the embryo transport system. Egg and sperm, they come together in the fallopian tube. That embryo will travel down the fallopian tube into the uterus. So part of fertility screening is not just the FSH, estradiol, AMH for women. It's not just to see how fast the swimmers are swimming, but it's also to make sure that the fallopian tubes are open. So before you start taking Clomid, and not knowing why you're not getting pregnant, make sure to get personalized fertility care and get your diagnosis before treatment. Don't do treatment before diagnosis. So let's talk about the Hsg. First of all, to survive it, ask, why am I doing it? Well, I just told you, to see if the embryo transport system or the freeway system that connects, I'm so bad at this, Oakland to San Francisco, so to speak, is open. So some of the questions people ask me are, what happens if they're blocked? Well, if they're blocked, that's what IVF was invented for. One of the first IVF pregnancies was actually in the fallopian tube, believe it or not. So even if you're planning on doing IVF, you still want to know if your fallopian tubes are blocked, believe it or not, because if you put that embryo in the uterus, you're at a higher chance for ectopic pregnancy, and there's a condition called Hydrocephalus, which is water in the tube. And if you have water in the tube, that is something that you would want to know beforehand, because that can also decrease your chance of pregnancy and increase your chance of an ectopic pregnancy as well. So why we do it? To check the tubes. When do you do it? Imagine this. You call cycle day 14, I'm ready for my Hsg, and the imaging center says, sorry, it's too late. So know when to call and schedule it. For my patients, your period starts, think of me. When you're pregnant, obviously I want you to think of me too, but anytime you have a period, you check in, you tell me, hi, my period started, I know exactly what to do next for you. And part of that for patients who are seeing me for the first time and starting their fertility screening process, it's ordering the Hsg procedure. Typically, we order it to an imaging center. There are some fertility clinics that we love in our area that do it as well, and they like to do it between cycle day 7 through 10, basically after your period is ended and before ovulation, so that we're not interrupting a potential pregnancy. And then what happens during the Hsg? Let me tell you, it's like a pap smear on crack. I would not know what a pap smear on crack feels like, but I can imagine a speculum inside the vagina, a catheter goes in, not into your bladder, into the uterus. The doctor will then push a radio-opaque dye into the uterus and watch that dye come out your fallopian tubes with a machine over your tummy, and then there's a screen right next door and you can see it in real time. Does that sound painful? It is. Would you ever imagine a guy sign up for that? I'm not doing male bashing, maybe just a little. Would you ever imagine a guy do that without being under anesthesia? No. So why do we think that women should do it without pain meds? So I was trained by some of the most compassionate doctors, and they taught me, Amy, pain is the reason why we have pain meds. So I offer all my patients antibiotics for infection, prophylaxis, a Tylenol with codeine 30 minutes before, and a Valium to relax you 30 minutes before as well. That way, when you go in, you're not screaming excruciating pain. You're not telling all your friends that was the worst pain I've ever had in my life. And certainly, patients going through fertility are having enough heartache. The last thing they need to do is have severe pain and not have anyone thinking about that ahead of time. So then another question patients ask me is, who should go with you? It is nice to always have a fertility friend. Especially if you're taking these medications, you shouldn't drive yourself. You can take a driver, take your partner, take your fertility friend, but you don't necessarily need a driver unless you're taking these drugs. Talk to your doctor about the pre-procedure medications. There's no reason why they can't order you these medications just before the procedure so that you can have a really comfortable experience. Ask the doctor if whether, because of the tilt of your uterus, having a full bladder would help. If, let's say, for example, your doctor's had a hard time doing insemination procedures and now they're doing the HSG, it might be a good idea to go in with a full bladder so that it's easier for them to get the catheter in. So that's basically how you survive the Hsg procedure. I make it sound like something awful, like being in an episode of Naked and Afraid. My favorite show, if you didn't know that. Seriously, one day I will be on that show. I will, and I'm going to win. You're all going to watch me. Seriously. So I hope you enjoyed tonight's episode, and I hope that the pro tips on how to survive the Hsg will make your experience a little better for you. Have a great night.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation.